There are 5 procedures around the eyelid that are commonly performed that I think you should avoid because they do more harm than good. So let's first talk about eyelid fillers, because there are a lot of mistakes made with eyelid fillers, and the choices that are made can have serious consequences for you. To begin with, there are what are called permanent fillers. Now, all the fillers can last a long time, whether they're classified as permanent or even the ones that are called hyaluronic acid fillers also can last quite a long time. But the permanent fillers, the ones that are non-reversible, are Radius, which is a calcium-based injectable, silicone, of course, and then there is Sculptra. Sculptra is a polylactic acid filler. I use polylactic acid fillers on the face, but not on the eyelid, okay? Because around the eyelid, it causes a reaction to the particles in this filler that create like a little tiny scars, and granulomas can form around this filler and leave little bumps and lumps where we don't want them. Obviously, we want a smooth filling of depressions around the lower lid. And the same with Radius. Radius is a calcium-based filler which creates a reaction to that calcium, and that also can leave these little granulomas under the skin. Because the skin is very, very thin on the eyelid, it's only less than a millimeter thick. So as a result, if it's injected under the eye, it's not the ideal place to inject because you get secondary problems that you don't want. Okay, and silicone, of course, I've seen silicone from patients who've gone abroad. They come back with some silicone under their eyelids or around their eyes, and that is even a worse scenario because it's integrated in the soft tissue and it's very difficult to get rid of, and there's no way to reverse it, and the only way you can do it is sometimes cut out some of the lumps, but not all of it, and because it's all a mess in there, and that's something you definitely don't want to have. If you decide to go to another country and they suggest silicone, absolutely stay away from that. Now, there are what I call non-permanent fillers, which are usually the hyaluronic acid gels that can be reversed with an enzyme called hyaluronidase. Okay, so those fillers also have issues if the wrong filler is chosen to fill a depression on the lower lid in particular, okay, or even on the upper lid. Sometimes there's depressions on the upper eyelid that are also filled with these fillers. And what the problem is that Juvederm has what is called a low G prime. A G prime defines the chemical characteristic of these fillers, and when there's a low G prime, that means their viscosity is low, and it tends to spread and attract a lot of water to the molecule, so there's a lot of swelling associated with Juvederm. Okay, sometimes that's desirable in certain parts of the face, but around the lower lid, it's not a desirable thing. You get too much swelling, and most of the time, Juvederm has to be removed with the enzyme hyaluronidase, which is the enzyme which breaks down this molecule. What I prefer, and I have no industry support to say this, I like Restylane. Restylane has a high G prime and is therefore denser, less viscous, and attracts less water to the molecule, so therefore you don't get as much swelling following the injection. Now, swelling does occur following injections, commonly, at least temporarily, when there's compression of the lymphatics due to just the mass effect of the injection on the lower lid soft tissue. So you can get temporary swelling. Usually it's temporary, sometimes it's not, but most of the time it's not, and that goes away. But if it doesn't go away, then you have to use these enzymes to break it down in order to dissipate the molecule. Now, the most important thing to talk about in terms of fillers is not only the type of filler, but also the technique of the injector, okay? Because whether you're a doctor or nurse injecting these fillers around the lower lid, across the internet, I see people using sharp needles, and sharp needles are definitely not a good technique to use to inject these fillers, because you can inadvertently enter a blood vessel and embolize the material in the blood vessel, and that can cause ischemia and necrosis, and even in rare cases, people can go blind, believe it or not. So I totally am taken back by any people on the internet showing their technique with a needle. I just think it's very dangerous. And the only thing I would say is whoever you go to, they should really be using a blunt cannula. Blunt cannulas can bump into a vessel, but they generally don't penetrate into a vessel. I really think they're much safer, and that's what you have to look for in terms of when they consider injecting this stuff into your lower lids. So let's talk about Botox or Botox-like drugs. It could be either Dysport, it could be Daxxify, it could be any one of these neuromodulators. In general, they are very safe if done properly. However, there are cases in which the injector injects in the wrong area, and it can end up to cause some significant side effects that can last quite a long time. It may last anywhere from 3 to 6 months, depending on the modulator that you're using. If the injector injects the lower eyelid in the inner corner here, it may paralyze the orbicularis muscle, which closes the eyelid and also pumps the tears down into the tear duct. So patients may then develop tearing. If Botox is injected in the central part of the upper eyebrow and it drifts down onto the eyelid, it may paralyze the elevator muscle that elevates the eyelid, and you'll end up with a ptosis of the upper lid that you may have to live with for at least 3 months to possibly 6 months, depending on the neuromodulator you're using. And by the way, the modulators like Daxxify, which last 6 months, are of greater risk because they last longer. So if they're injected improperly, you have to live with the consequences of that injection even longer. So let's talk about medical devices around the eyelid and which ones are good and bad. As far as I'm concerned, a microneedling radiofrequency device is not an appropriate device for around the eyelid. Why? Because I think it penetrates through the skin to a deeper layer than is necessary. The eyelid skin is only 1 millimeter thick, and radiofrequency microneedling can penetrate up to 5 millimeters in thickness. Yes, you can dial it down and so forth, but I don't think it's the ideal instrument to rejuvenate and smooth out the skin. I think there's a chance you can get fat atrophy, you can get some scarring, you can get some irregularity of the skin. I am not a fan of radiofrequency microneedling, even though I own that device and I use it on other parts of the face. I don't use it on the lower lid. Another device that I clearly don't like is Ultherapy around the eyelids. I think this high-intensity focused ultrasound device can penetrate too deeply below the skin again, and the handpiece is not well adapted to the size and the shape of the eyelid, so it's not really the device of choice for any rejuvenation around the eyelid. And the last cosmetic treatment that I really want you to avoid is PDO threads, because as far as I'm concerned, PDO threads are not worth the risks associated with them. They only last about a year at best after they're inserted, but they can cause scarring, they can cause distortion, asymmetries, and the little barbs on these little threads can also poke out and cause problems. I've seen patients come in who've had PDO threads around their brows and their eyelids, and they cause a lot of discomfort, and I totally am against anybody using PDO threads to raise their eyelids or change their eyelid contour. I know for a time fox eye contours were the rage on the internet, but I have seen personally patients come in who have been really injured and had serious complications from these PDO threads. So I don't believe they should be used in any way around the eyes. I'm here to advocate for you. I want you to avoid some of these errors that people have made, whether doctors or nurses, and I want you to avoid these errors so you don't end up with serious complications. If you have any further questions, please leave them below. I'm happy to respond to them, and I look forward to seeing you in my next video.